Hello, I'm Eluned Morgan, Minister for Health and Social Services in the Welsh Government, and I'm really honoured to have been asked to launch the framework for health and social care on behalf of the voluntary organisations in Wales. This framework is a really important contribution, but before I talk a bit more about that, I just wanted to say a thank you to all of those volunteers who really stepped up during the pandemic. It really was a sight to behold. It's been incredible the way that volunteering has become absolutely mainstream within our society. And I, for one, am determined not to lose that momentum and the gains that we made during that time, because volunteering, we know, gives so much, not just to the people who receive the support, but to those who are giving the support. And certainly when it comes to mental health, there is plenty of evidence to demonstrate that actually helping other people, also you are helping yourselves. But I am delighted, and I can't thank you enough for the particular role that you played during the pandemic in stepping in, supporting our health and social care services, in stepping up to support our communities. And what we want to do now is to make sure that we embed that. And that's why this framework that you're launching today is so important. Making sure that people are asking the right questions in the right way and embedding that learning, the learning that so many of us have really got to grips with during the pandemic. And I know the work that the Welsh Council for Voluntary Action have put into this, the help force supported by the Welsh Government and other partners, means that what we're doing here is building a national programme to promote and that role and the value, more importantly, of volunteering within our hospitals, and also to make sure that we're developing innovation and new improvements across Wales. We've seen some really poignant programmes being developed during this very difficult 18 months that we've all lived through. And what's interesting is that actually it all is central to the theory and the principles that we hold dear to in terms of our programme for government and our programme for health in the Healthier Wales. We need to make sure that we really keep this learnt experience, that we reposition the status of volunteering as a result of the pandemic. And I know that the framework has been developed by Help Force Cymru, the Bevan Commission, Social Care Wales, and Richard Newton Consulting Limited, and of course supported by us here in the Welsh Government. So our goal is to assert volunteering as an integral and valuable aspect of the health and social care workforce of the future, coherently integrating volunteering into the fabric of our health and social care services. So I would like to commend this framework, which I know will have far-reaching implications for you in the WCVA, but also for all those organisations who are very keen to embed all the learning. We are extremely grateful to all those volunteers, but also to those leading our voluntary groups for really getting everybody together, organising people to really come together as communities and as a society. Diolch yn fawr iawn I chi am bopeth I chi wedi wneud. Dwi'n ddiolchgar iawn I chi am ddatblygu'r fframwaith yma. Fydd dwi'n gwybod o fydd I pob un sy'n gwirfoddoli yn arbennig ym maes iechyd a gofal. Diolch yn fawr I chi a gobeithio eich diwrnod chi ar lawnsiad yma yn arbennig o dda.